Hi, this is Helen Little, and I am on CEO Unplugged today. We'd like to welcome Daniel Raio to the show. How are you today?
I'm great. How you been?
I'm good. Now, Daniel is the CEO of House MD. And first of all, I want to thank you not only for being here with us today, but for what your organization is doing at a time when we all need it.
Appreciate that, Helen.
So what is your company doing to help people get tested?
That's a great question, Helen. And a lot of people are looking to get this testing. House MD Visit's been on the forefront of what we've always believed to be the new age of healthcare delivery. A few short months ago, telehealth wasn't the first thing that we all thought of when we discussed going to see our local physician. When this pandemic started, House MD was positioned to help the communities across the state that we serve and first responders affected by the virus in a very effective and meaningful way. Our robust and enhanced virtual visit program allows our medical team to safely and quickly assess patients in the comfort of their own home. Through our HIPAA-secure telehealth platform and easy online scheduling portal, patients can log on to housemdvisit.com or download our app for on-the-spot assessments with one of our physicians and PAs on the same day. If medically prudent, their provider will then transmit a prescription electronically to the nearest lab performing the recommended antibody test. All the patient does from there is show up, get a simple blood test, and unlike other programs where there's no or minimal practitioner involvement, our doctors and PAs make sure our patients are contacted and the results discussed in detail.
You make it accessible and easy, and you brought up a word that a lot of people have questions about. What is the antibody testing, and what information does it really give us?
So an antibody test is a screening for things called antibodies in your blood. Okay. Your body makes these when it fights the infection. So like COVID-19, the same thing happens when you get a vaccine like a flu shot. That's how you build immunity to a virus. The antibody test isn't checking for the virus itself. Instead, it looks to see whether your immune system, your body's defense against illness, has responded to the infection. It takes your body about 4 weeks to develop antibodies, but scientists aren't sure how long it'll take for this to happen with COVID-19. More time to find that out. But keep in mind, the current antibody test can't tell you if you're immune to COVID-19. That's because we don't know how long these antibodies might protect you against coronavirus. And these tests shouldn't be used to diagnose the virus.
So how accurate are they then if you don't use them for diagnosis?
Well, so before I can truly explain accuracy, it's important that I explain what sensitivity and specificity from a medical perspective means, right?
Okay.
So sensitivity measures how often a test correctly gives a positive result when a person has the disease. A low sensitivity can result in a false negative, incorrectly identifying sick folks as healthy. In the case of COVID-19, a false negative would mean that the test says you do not have antibodies against the virus when in fact you do. The higher the sensitivity, the less chance there'll be to have a false negative result. Specificity measures how often a test correctly gives a negative result when a person does not have the disease. A low specificity can result in false positives, incorrectly identifying healthy people as sick. In the case of COVID-19, a false positive means the test says you do have antibodies against the virus when you actually do not. So the higher the specificity, the less chance there'll be of a false positive result. It really depends on the lab you go to, the machine they use to test your blood. At House MD Visit, we've been recommending Quest Laboratories. Quest only uses COVID-19 antibody IgG immunoassay test. It's from the manufacturers who demonstrated robust validation of their test kits. Sensitivity from this specific lab is approximately 90 to 100%. This is dependent on timing of the sample collection and when the patient is exposed to COVID-19 virus or starts having symptoms. The specificity is approximately 99 to 100%. So I'm sorry for the long-winded answer, but
it's okay.
It's a confusing topic, and it's very important to us at House MD that we explain it, fully so people understand what these things mean and how we're going to use them in the future. These results.
Right. So how worried should healthy people be in terms of getting COVID-19, and who is really most at risk? I've heard so many different answers to that question.
Yeah. So look, Helen, this is a very scary virus, right?
Yeah.
That I'm proud of the team here at House MD. I'm proud of my fellow New Yorkers, including the local and state government, especially all the first responders. I'm not surprised that New Yorkers come together as one, everyone doing their part, from extreme social distancing to essential employees risking everything on those front lines. Most healthy people who become infected with COVID-19 have no symptoms or mild symptoms. However, there have been healthy people who have progressed to severe disease. People who have underlying illness and who are older are at higher risk for getting severe disease. They're at higher risk. So I think worrying is natural, but don't forget, we're New Yorkers, and together we can all rise above and persevere. House MD was here for New York before COVID started. It's here for New York now, and we'll continue to serve the communities across this state after we've all defeated this thing. So worry not. Let's all just listen to the CDC and New York State Department of Health guidelines, follow recommendations from your doctors, and stay vigilant and focused. Do that, and I think we all pull through this thing.
That makes me feel so good to hear you say that, and makes me feel a little bit more relaxed and actually confident that we can do this together. But you know, everyone is getting antsy about being inside, especially those with young children as states start to open up. How should people continue to protect their family?
So I can only attest to how House MD Visit is approaching this very valid and serious concern that people have. Look, I have a 4-year-old boy at home. And trust me when I say, we're all antsy for him to get his play dates back. House, you know, we're working with daycare centers, school systems, other kid-friendly businesses to help guide them into safe opening practices. I know the fear is apparent myself. And at House MD Visit, we want to do all we can to help the state get children back on the playgrounds and the ball fields safely and securely as we can.
So there are lots of telemedicine companies out there. You're just one of maybe 300. What makes your company different from other telemedicine companies?
Well, let me answer this question pretty simply. We're not just another telemedicine company.
Okay.
House MD Visits believes quality care requires a hybrid approach. We utilize our HIPAA-secure telehealth platform in concert with in-person physician or PA visits to your home at least once annually. So there's a big difference there between just a telehealth visit and one and done and that's it, and us. We believe in continuity of care. We have virtual exam technology such as the virtual stethoscope and otoscope. We can extend more frequent visits to those patients with chronic disease such as congestive heart failure by deploying a House MD Visit patient advocate with our virtual exam kit. This lets the patient's medical provider see the patients virtually with extra necessary clinical diagnostic capabilities. And lastly, we've established brick and mortar relationships. This is very important in many areas across the state, especially on Long Island. Mm-hmm. As part of our shared care initiative, this allows patients to confidently keep their great doctors while also allowing us to participate alongside them in their care.
So what are your plans moving forward post-COVID-19?
Our main focus and the mission of our company, Medical Practice, has been to deliver convenient and quality healthcare services to the communities that we serve. I see no reason why that should stop now. If anything, we're determined more than ever to share our services in a more robust way as we navigate through this post-COVID era.
And it's interesting as I listen to you, I'm like, you should be everywhere. But what are your goals for this company?
So at House MD Visit, our main goals are to start to engage young people in the importance of routine annual exams, educate them on the purpose of preventative care, how they act today with regard to their involvement in their own health will directly affect the America that we see tomorrow. Look, healthcare in this country is on an unsustainable path. The enormous cost of the system is like an anvil pulling this country deeper and deeper into this black hole of unsurmountable debt. If we can achieve buy-in from young Americans through this type of healthcare delivery system, then we could be a part of solving the healthcare crisis in this country. And maybe together as a medical community, we can all make this country that we all love a better place for our children and our grandchildren in the years ahead. I know it's a lofty goal, but I feel one that we can attain together.
So that means you do so much more. You provide so many more services besides COVID-19 antibody testing and focusing on this, you guys actually have far more services. Tell us a little bit more about that.
Yeah, so we've developed a practice that has multiple specialties that we can offer and services that we can offer. For example, we work with the geriatric population as well, right? Which is what you normally think of when you think of a house call, right? But this isn't your old-fashioned house call company. Well, I should say it's a new take on the old-fashioned home visits. We provide care to folks that have cardiac conditions. We have a board-certified cardiologist that oversees that program. We have orthopedic surgeons that are involved. We just brought on a pediatrician, which I'm very excited to delve into, because it kind of allows us to really practice family medicine in a meaningful way. And obviously, we have urgent care, so we have 2 board-certified emergency medicine physicians, as well as internal medicine. So we have a whole plethora of services from the medical perspective, and believe that we could handle most needs of the medical community.
That's also comforting. So as everything starts to reopen, how concerned should people be about getting back to work?
This is the one of the biggest fears that everybody has. Getting back to work safely and confidently is important, and mostly so for people that are suffering enormous amounts of financial burden, which is also not good for your health. It increases anxiety and stress levels. So our goal here at HouseMD is to help the businesses and the communities that we serve and guide them from a medical perspective through our Back to Business initiative. And that's just simply doing what we do best, providing our services. We're not asking for any special accolades or anything like that, but we're asking to do our job, and we're here to help you. So if you're a business owner and you don't know how to reopen properly, you're confused about the guidelines that are out there, and sometimes they change on a dime, you could give us a call. There's things we could do to help you out. It's something we want to do for New York. It's something we want to do for this country, and we're here for you. So I won't go into detail on that, but if you're a business owner, feel free to give us a call. Check out our website, housemdvisit.com. You could find some information, and I'd be glad to speak with you.
Thank you so much, Daniel, and thank you for the work that you're doing. I feel somewhat inspired by learning from you, and I did learn a lot, and I appreciate you coming on CEO Unplugged and sharing with us all that you're doing to help keep everyone safe. That is beyond appreciated. So thank you so much for coming on.
Thank you for having me.